Thank you for joining this series of webcasts run by Break, the road safety charity. The aim of the series is to give family liaison officers and family liaison coordinators a deeper understanding of the services that Break provides to professionals and bereaved families through our National Road Victims Service. Break's National Road Victims Service is proud to work in partnership with all UK police forces to help road crash victims get the support they need from our service and to support the professional development of police officers in family liaison roles with road victims. In this webcast series, we will discuss topics including the National Road Victims Service, police awareness training, the role of the Independent Road Victims Advocate, Break's bereavement packs, and Break's serious injury guide. I would like to take a moment to say thank you to our webcast sponsors this year, Hugh James, Simpson Miller, and Slater & Gordon. The first session in this series of webcasts will give you an overview of Break's National Road Victims Service and explain how Break supports people affected by road crashes and the people who care for them. I would now like to introduce the manager of this service, Tracey Lister, to give a detailed overview of the service offered by Break.
Hello, I'm Tracey Lister, the Operations Manager for the National Road Victims Service and Sudden here at Break. I've worked at Break for almost 3 years, my previous roles being with the Victim Service setting and also at the British Red Cross. I am extremely proud of the work we do, the quality of the support we provide to people who have been bereaved or seriously injured through a road crash, and the dedication of my staff team. It is extremely important that we acknowledge that every bereaved person should have the right to access specialist support and care from day one if it is wanted. Unfortunately, this is not always the case. Some people do not have the strength to get dressed in the morning, let alone find the courage to pick up a phone or send an email. One caller explained in her own words what her life felt like when she managed to dial our number. I couldn't do anything. I couldn't concentrate nor talk to anyone. It can feel hard to get on with normal tasks, even simple things such as getting dressed or doing the washing up. Quotes like this one are unfortunately words that we hear every day from people who were so traumatised and desperate for someone to listen to them, make the pain go away and help them access care and support. Your role as a professional is crucial. You have the ability to take away the barriers to access support and with consent refer bereaved people into the National Road Victims Service for specialist support provided by expertly trained caseworkers. How do we provide the support here at Break? We are all unique, individual, able to cope or not cope in our own ways, and one size does not fit all. I have learned over my career to work in a person-centred way, to embrace everyone as an individual, to tailor support around people's needs, their circumstances, their challenges, and most importantly, not only listen, but to hear them. This is why a case management approach to support services is crucial. The option of having an early intervention space for people to access safely, feel supported, be able to take their time to explain their circumstances is paramount. It should be accessible, meet needs and be collaborative. This is where we can work in partnership with your role and can support the families that you are engaged with. Many people access the service not knowing what they want, how they can help themselves or where to turn to, what is a normal feeling in these circumstances, and how will I ever be able to live again. This is where we can work alongside them to engage with families and individuals, provide them with a supportive and person-centred environment and structured support, focusing on outcome goals and risk management. Through our ability to structure the support we give to people, we can enable people to navigate around their life in a way that becomes clearer. Our nationally accredited literature, children's books and resources enable our service to provide individuals and families with access to alternative ways of recovery. They provide a source of information, a way for families to engage together and help them cope with their traumatic circumstances. The National Road Victims Service is here to support professionals from all sectors. When you are dealing with anyone who has been suddenly or traumatically bereaved, we can work alongside you to provide a specialist support service to your families whilst you are focusing on your own role. With many of our families, we work side by side with other professionals, other support services, providing an holistic, supportive environment. Introducing our National Road Victim Service team here at Brake. As you will see, our National Road Victim Service team is made up of a number of different roles, which enables the service to have resilience, differing expertise and experience, providing the people we support with a foundation of exceptional care. The professional backgrounds across the team consist of an intensive care unit nurse, counselling and therapeutic professionals, probation officer, roads policing officer and trained family liaison officer, serious crime detective, victim services and crisis intervention professional, mental health advocate, research and information and social work expertise. We have a clinical consultant role within the National Road Victim Service, providing the team with clinical guidance and supervision across the service, both for the staff and the people accessing the service. The caseworker roles are the foundation of our support service, the people who you will engage with when you contact the service. They are the voice on the end of the telephone or email who support the people you refer into our support, and most importantly, they provide the bridge between your role and that of the National Road Victim Service. Our associate caseworker team are professionals from private practice with backgrounds in therapeutic practice, social care and counselling. We have invested in this team this year to provide the National Road Victim Service with a model of resilience to flex to the ever-changing demands on the service and those difficulties arising from the pandemic and the effect on people's ability to cope. We have provided these skilled individuals with training around the NRVS service and our SENSE model. They are providing a casework methodology approach to service support. Our research team work hand in hand with our caseworkers. This team provides the caseworkers with partner and service information across the whole of the country. They liaise with services across the country, ensuring that the services that we provide to people and who we signpost and refer into have availability. We know what type of service they can provide and to who. This is instrumental as we can ensure that we are not re-traumatising someone by giving them information that is not up to date and correct. As you will know, services across the whole of the country are changing daily due to the effects of the pandemic, and this is an ever-increasing challenge for everyone. We here at the National Road Victim Service provide you with the help and support to access services for the families and individuals who you are supporting. Who can we support? Brake's National Road Victim Service is for people living in the United Kingdom who have been bereaved or who have suffered a serious injury in a road crash either in the UK or abroad. This includes family members, partners of people who have died and close friends. Our service is also available to anyone who supports someone bereaved or injured in a road crash. This includes, for example, carers, police family liaison officers, emergency service workers, counsellors, GPs, faith workers and teachers. We assist you to provide the best possible help to road crash victims and also support you if you were involved in the immediate aftermath of a fatal or serious crash and feel traumatised as a result of this. We can help if the crash happened recently or some time ago. Brake's Road Crash Victim Service exists to help relieve the suffering and assist the recovery of people bereaved and seriously injured in road crashes. We receive self-referrals, referrals from professionals and any other organisation who are working with someone who has been bereaved or seriously injured. Access into the service is through our helpline, email system or by our online referral forms on our website. Through our national literature that is distributed across the United Kingdom, families have the information within these packs to self-refer into our service, or if they have not been able to do so, professionals working with them can do this for them. Our caseworkers support people aged 18 and above and can support families with children by providing and liaising alongside specialist child bereavement support services. Challenging circumstances and facing these. Sudden death can unfortunately present people with very challenging circumstances. Trauma experienced when someone dies suddenly or after only a brief illness, a loss of future and shared plans. This can keep people on the merry-go-round of asking why, how can I move on, why should I move on? I often say to my team, when someone is unable to move away from this phase, it is like hitting the pause button on life. Our service is there to try and enable people to move out of the pause phase, and with listening, kind interactions, supported planning, being able to see some way forward in a structured and supportive way, acknowledging their pain and stabilising where they are. A loss of care provided by someone who has died. This is particularly difficult for a family if they are struggling with the loss and on top of that trying to, for example, financially survive. This can absolutely devastate a family dynamic and create a ripple effect to cascade out into other areas of life. Someone may now have to work full time, whereas before they did not work or only worked part time to look after children or family members. This can result in extreme stress and distress for the whole family. Pre-existing vulnerabilities of a bereaved person, for example, illness, disability, living in poverty and social isolation. Sadly, as a service, we have had many times when we have had to advocate on someone's behalf as they have had nowhere to live, have not been able to contact their GP for medical help, or had the strength to call a loved one for support. The time we are living in, COVID-19 has brought with it its own set of vulnerabilities, building upon the ones which we already had in our lives. Fear and physical distancing rules mean we are all at risk of feeling stressed, anxious, unsupported and isolated. We are also not able to say goodbye in normal ways before or after any death. Sudden Underbreak is a support service here for people who are suddenly bereaved through COVID-19 and any other sudden death. By having a structured trauma-informed approach to support using the SENSE model, the National Road Victim Service is able to support your families and yourself by working together, enabling people to support, to try to help to build their lives into a different way. What does case management look like? Case management help for people bereaved in challenging and sudden ways should be accessible, meet needs and be collaborative. If it needs to provide one access point into the service and then work with people to enable choices, engage in goal setting and be time framed to ensure that expectations are not raised and then not met. The National Road Victim Service and Sudden Service here at Break provide a central point of access and contact to help suddenly and traumatically bereaved people through the terrible shock and trauma caused by a sudden death. The caseworker's primary role is to ensure safe entry into the service by safeguarding against harm and risk assessing someone's circumstances on entry into our service. The service provides a needs and risk-led approach whilst using the technique of watchful waiting in the first 10 weeks to ensure that the people we support are safe. The National Road Victim Service provides short to long-term support depending on individual circumstances and the support and care required for that person or family. The support provided is not counselling, it is an early intervention space which is actively monitored to ensure that risk is identified and if necessary, escalated to prevent harm. We work closely with the person to ensure that they are aware of the support that can be delivered and then to plan this effectively with them. We ensure that people are empowered and enabled to make their own choices and are aware of the boundaries of our service and how we can work together to provide specialist support services in their geographical area. We work in collaboration to produce a support plan with identified goals encompassing an agreed exit strategy. The SENSE model. The SENSE model offers an early intervention approach which provides support to both individuals and their families. It is underpinned by the principles of trauma-informed practice, focusing on supporting coping, identification of support needs and promoting access to relevant long-term care. It provides immediate stabilisation by identifying and addressing practical and emotional needs, explores support connections, enables access into immediate care if required, builds bonds and engagement through social and support interventions, and ensures a safe and supported exit from our service when this is appropriate. It creates a framework in which to establish and manage relationships in the delivery of an intervention. Stages of the SENSE model. This addresses the immediate practical and emotional needs of someone entering the service and ensures any safeguarding or risk indicators are actioned. This could be by engaging with emergency GP services, mental health crisis teams and other partners. We have unfortunately, since the pandemic, seen more complex cases entering our service and people who have required immediate safety measures put into place. It is true to say, importantly, if someone is not sure what they need, they are often able to tell you what they do not need. Education Stage 2. This stage is about helping people to understand and recognise how they feel. The caseworker will work with the person to establish a baseline of intervention to begin to construct a support plan around their need. Normalisation Stage 3. Information and understanding will provide reassurance that responses to the crisis are normal and expected. The National Road Victim Service is able to do this through caseworker intervention work, providing information and resources around normal feelings and physical symptoms, and also acknowledging when someone is not coping well and putting emergency planning in around their needs. We have a clinical consultant who is part of the service, and any identified clinical concerns are escalated to the consultant for overview and advice. Stage 4, social support. By facilitating connections with family, friends and wider support networks, we can support families to identify positive bonds whilst acknowledging negative influences. Interventions can focus around identifying sources of support. This can include people, places, animals and activities, anything which the person identifies to support them, enable them to cope. Considering how access to this type of support can be strengthened and enhanced, we also use a technique called support mapping, where people are encouraged to draw or illustrate their support networks and how these bonds influence and provide them with care. Engagement, the final stage of the model, is focused on promoting the person's engagement with sources of support and activities which they find meaningful and beneficial. This includes both formal and informal support, such as, for example, psychological or psychiatry services, as well as engaging on other activities like yoga, meditation, sports, or arts or crafts in recognition of their therapeutic effect and the ways in which such activities may support coping and increase a person's access to social support within their wider community. Next steps and working together. I hope by having an overview of our National Road Victim Service and how we provide the support and care for someone who has been bereaved or seriously injured, you are able to provide the families that you are supporting an explanation of our service available to them. We are also here to support you in your roles and to work in collaboration to ensure that any family or individual who have suffered a loss has accessibility to the care that they deserve in these difficult circumstances. Together, we can build a bridge of support for everyone who has been bereaved by a road death. Thank you for listening.
Thank you for listening, and thank you to Tracey for delivering this presentation. Our next webcast, The Role of the Independent Road Victims Advocate, will be available soon. If you want to find out more about BRAKE's National Road Victim Service, please visit our website at www.brake.org.uk. Thank you again to this year's webcast sponsors, Simpson Miller, Slater & Gordon, and Hugh James.